You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. And today we have New Jersey's go-to cosmetic dentist, Dr. Marlen Martirossian. Dr. Martirossian, welcome
Glad
to the
to
program.
be back, Randy.
Yeah, welcome back.
Thank you.
Now I know this time you brought a stack of photos, pretty dramatic.
It is,
and I
indeed.
guess we're going to talk a little bit about kind of cosmetic dentistry, cosmetic dentures.
Sure.
And I guess you're the inventor of these New You dentures. Is that correct?
That is correct. It's a patented way of fabricating dentures.
Okay, and we'll talk a little bit, of course, about some TMJ problems, people with this
Sure, we'll touch on
these
that.
programs. Now, for people that don't know your practice, like who's the typical patient? Because I know you do a lot of things.
Randy, I don't have a typical patient. We see patients all types, of all ages, all walks of life.
Okay.
We get teachers who, through the neglect of their self-care, are embarrassed to be in front of kids, and kids making fun of them.
Because of their teeth?
Because of the way they look, because of their teeth.
Okay.
We have firefighters who had bad experience as kids, had fear throughout their life, neglected their health, their teeth, and now are ready to tackle it and be confident again. We have stay-at-home moms that put their kids through college, and now it's time for them to pay attention to themselves and want to look better. We have older folks that retired and now want to feel better, they want to function better, they want to be able to go out with their friends and not be embarrassed of a loose denture, they don't want to be in pain, etc.
Okay.
So we don't have a typical patient.
Now, you were on my program, a few years ago, and now you've kind of gone through a rebranding. Wellness is in the name. What does wellness mean to you?
So the name of my practice is Marlen Elite Dental Wellness. And what's funny, a lot of people, a lot of patients think that elite means that we're only seeing Hollywood stars or we're only seeing business executive. But actually, it's the other way around. What we're trying to do is for every patient that walks through our doors to have a unique, personalized, customized experience that geared towards their wellness. So what does wellness mean mouth-wise? So when the patient comes in, what we take a look at, we'll look at their mouth in relation to their body. Unfortunately, some dentists think that mouth is a separate entity from the body. But in fact, what we do, we'll look at teeth, we'll look at the muscles of the head and neck, we'll look at how the joints function, we'll look at the bacterial infection in the mouth. What's interesting, there are more and more studies that show that the bacteria in the mouth has an effect to your heart. They're more associated with cancer, etc. So what we try to do, again, we try to take a look at everything holistically. An example is sleep apnea. So we look at airway of every patient, we treat it with the oral devices, and that helps save lives.
So let's start with I'm calling them cosmetic dentures, but I guess you created this New You denture. You've reinvented, re-engineered dentures for better fit, better look, etc. So what is a New You denture?
So New You denture is a new way of making customized dentures. So with traditional dentures, what dentists do, they just replace teeth that were missing for a long time. With a New You denture, besides just replacing teeth, we're replacing the bony structure that was lost through the years of missing teeth. So basically, we give people a mini facelift effect.
How so? What do you mean mini facelift?
So again, when the bone is missing, the structure of the face starts to collapse. So traditional denture have that infamous notion of
like a sunken face look we see.
Yes.
Okay.
That's what the traditional dentures are. You have that sunken in look. So with New You denture, when we replace the bony structure that was lost, we give a mini facelift effect.
Now, what do you mean mini facelift?
So it sort of improves the jawline. It makes people look 10, 15 years younger versus just replacing teeth.
Now, I told you I kind of doubted that. It's like, it's just teeth, right? You said you're going to show me photos to prove this. Right?
Absolutely, we can get to them.
Yeah, let's take a look.
Sure.
Let's take a look. Now, these are this New You denture, right?
It is New You denture, that is correct. So let me tell you about Gloria. Gloria is a retired teacher who went through some medical issues and lost teeth. What's special about Gloria, what she loves to do, she loves to go to diners. So in New Jersey, we have diners that people go for breakfast, lunch, etc. So every morning, Gloria goes with her friends to have breakfast. When she came in for a consultation, she told me, "Doc, I can't see my friends anymore. I'm embarrassed. I'm missing teeth, and I'm at the point of my life when I want to feel better, when I want to feel younger, etc." So what we did, obviously we evaluated, we did a 3D digital scanning, and we came up with a treatment plan. So what we did for Gloria is we did a top teeth, there are a new denture, and then we did a snap-on teeth on the bottom, more implant-supported new denture. And look at the result, Randy.
Okay, very nice.
Would you say she looks younger?
Yes, okay.
Do you see the light in her eyes? Look how beautiful her blue eyes are comparing to the picture before.
Yeah, her eyes are opened up a little bit. You know, I was telling you off camera, I said, I feel like I could spot a denture walking down the street. Now, these look natural. So is this all done on a computer today?
It's all done on the computer. And by the way, when she came back for a follow-up, she said her friends would not believe it is a denture. They said, I had some cosmetic veneer work done, but it is actually a denture. And by the way, to touch on the different types of denture that we do in the office. So we have 3 different options. One is a fully removable new cosmetic denture. One is a snap-on denture that comes in and out, definitely gives you a better fit.
Okay.
So function. And then
you say it's a better fit. It's a better fitting denture. So can they eat better with it?
Absolutely. And if you allow me just to tell you the difference between traditional dentures and new dentures.
Okay.
So first of all, again, as I mentioned, with new dentures, not only we replace teeth, but we replace also the bony structure that is missing that causes that face to collapse.
Okay.
So that, again, gives a very beautiful aesthetic result to the denture. Another big difference between what we do versus a traditional denture is the way we take a mold for the denture. So with traditional dentures, dentists just put the gunk on the teeth, take a mold in a sort of static position of the mouth. Okay. What we do, and we do have a special equipment, it's called TENS, that causes sort of like a deep massage of the muscles of the head and neck. So that mimics the chewing. So when we do take a mold for the new teeth, it's done in motion. So what's good about that?
Yeah.
So it definitely improves the fit of the denture and causes less post-operative discomfort, basically. So definitely improves the fit. And then the last big difference about the new dentures is the way they are made. It's a fully customized approach to making teeth. We have a special ceramist that works. He perfects the gum tissue of the denture.
So they look real.
They look absolutely real. He perfects and puts the translucencies on teeth just to make sure they look more natural. So again, it's a completely customized approach to giving people their new smile. And what's also very important about the new dentures is some people can afford implants. Some people can afford $50,000, $60,000 treatment. So with new denture, it gives you definitely a much better look. It gives you much better fit. And again, people tend to look 10, 15 years younger.
Very nice.
Here's another patient. This is Donald.
All right.
Great individual, very good personality. What he told me is for the last 10 years, he's barely left the house. He's embarrassed.
Really?
He did neglect his teeth, also some medical issues, but the fact is he doesn't socialize. And how do you not socialize at that age? You'd like to be with your friends. So he was at the point of his life when he said, I'm ready. No matter what it is, I'm ready to feel better, to look better. So again, we went through a process of customization for his face, his teeth, his personality. And we did new cosmetic denture. And again, look at the result.
Very nice.
I always like to look at people's eyes after their transformation. It literally lights up. You told me, Randy, that you tend to be skeptical about smile makeovers, new dentures, and stuff like that.
That they can make you look younger.
Absolutely.
I think it's clear, yes.
I mean, look at Donald. He definitely looks younger. He looks more self-confident of himself.
And more handsome.
For sure.
So the way you're able to make the teeth just perfectly fit the smile, what that's done on the computer first, and then it's like a digital process to make the teeth?
That is correct. What's unique about our approach to designing teeth, designing smile, is the digital approach to it. So we pay attention to the facial structures, we pay attention to the eyes, and then we try to digitize everything and show patients. Okay. We make sure that the smile line follows the lower lip, because that's the most natural way, the most aesthetic way of doing it. And again, when patients look at it, then they say, I love it. This is me.
You said before he was ashamed, didn't want to go out to eat with his friends. I think you said, when it's all done, now what? What does he say?
I mean, for me, this is aging gracefully. I mean,
okay.
he's not afraid to go out. He's not afraid to eat food. He's not afraid that that denture is going to dislodge during his lunch and him being embarrassed in front of his friends. Joanne. So Joanne is an interesting person. She's forever student. She's a nurse who went through nursing, who went through masters to become a nursing. I think she even teaches now. So Randy, I mean, if we take a look up close, you'll see that she has gaps in between her teeth. In fact, I think one side is a partial denture, and you can actually see a metal clasp showing through. She has very flat teeth, and again, flat teeth is a sign of aging. So what we had to work on is trying to improve and make her smile younger, try to get rid of the gummy smile that she had and it was bothering her. So again, we did a new U denture. I think that it is a snap and new U denture. Look at the curvature of her smile. Look at her again, bright smile and longer teeth that again make her look younger. So I can definitely tell you that being a master's in nursing, working with patients, she can smile with confidence and not think about it twice.
What's it like when they look at the mirror for the first time?
Hard to describe, Randy. I mean, it's the tears of joy, tears of why didn't I do it earlier? What kept me from doing it 10 years ago? But it's so gratifying to see those patients, whether it is new denture, whether it is a smile makeover, to look in the mirror and cry a cry of happiness. Randy, another patient I actually saw before COVID. She was, again, a nurse also, happened to be a mom who put her kids through college and again, was embarrassed. Obviously, she's missing some teeth. Again, we did custom-fitted new U dentures. Again, this is the person, Randy, that did not want to spend $50,000, $60,000 on dental implants. So new U dentures were the best option for her to give her a better look, replace some missing teeth, give her a better fit.
She does look younger.
She definitely looks younger. She looks happier. And who wouldn't? And what's interesting about Dawn, Randy, that besides her bringing both of her sisters to our office to try to improve their smiles, she just likes to come. She comes almost every week just to say hello, just to sit with us and just to appreciate what we did for her life, for her confidence.
I like how you say they have regrets. What do you mean by that?
I mean, number one regret of all the patients that we see is, why didn't I do it earlier? What kept me?
Like they go 10 years, you say, with hating their teeth?
10, 15, 20 years of being afraid of hating their teeth and not making that leap into, again, the new state of confidence. And then whatever happened in their life that pushed them to make that step, and again, the only regret is, oh my God, why didn't I do it earlier? And now, Randy, let's switch to our smile makeovers. We also call it facial rejuvenation dentistry. And I know you were skeptical about really teeth would change person's life.
Or appearance,
Or appearance, teeth would make people look younger. Look at Paul. I mean, Paul came in barely showing his teeth.
Is it because he couldn't? Like his teeth weren't long enough, or he was ashamed of them?
It's because, again, Paul ground out his teeth to literally little stubs.
Okay.
I mean, if the patient looks in the mirror and sees an older person versus their biological age, when a patient doesn't smile anymore, doesn't show their smile, or only shows the bottom teeth.
Okay.
When the patient's face starts to sink in and collapse, most likely those patients are ready for smile makeover or facial rejuvenation dentistry.
What did you do for him?
I mean, I'm super excited to show you the after picture of Paul. Again, if we pay attention to the lower third of the face, if you see how collapsed that part of the face is, again, that makes people look much older. So what we did through some very conservative porcelain work, veneer work, we restored Paul's bite. We restored the way teeth mesh together. We gave him that length of the tooth that he lost through grinding and clenching his teeth. And again, look at the lower third of the face. I mean, look at his face in general. He
looks much different, much better, actually.
I mean, how old is this guy? Definitely much older than the Paul after the smile makeover. He looks much younger, I agree.
So it's a combination with like crowns or veneers, or what are you doing?
It is a combination of veneers and possibly some crown work. The way we do it is not the traditional way. I am an LVI graduate, which is Las Vegas Institute for Advanced Dental Studies. So I was trained at Las Vegas Institute for Advanced Dental Studies where the dentists from all over the world get together to learn how to tackle complex cases. So obviously, patients sometimes ask how long will the veneers last, and they know sometimes veneers break and chip and become sensitive and stuff like that. So the way we approach cases like that is through, again, physiologic. We call it a physiologic dentistry. What we do, we establish where the teeth are supposed to mesh together. We have special technology that allows us to not only restore the teeth, but put the teeth in the bite position with the muscles of the head and neck, and the joints, we call it TMJ joint, is in harmony. So everything is working in harmony. This is Casey, a very interesting person. He retired and he told me, I am ready to travel. I want to go all over the world. And when I do, I want to make sure that I can smile, that I can function, that I won't be embarrassed sitting in a Parisian restaurant eating delicious food. I want to make sure I'm enjoying my retirement life. So again, with the help of physiologic dentistry, we restored Casey's teeth. We did some implants, we did some crown work, veneer work, and again, look at this result.
Very nice.
So who is ready to travel, the old Casey or the new Casey?
Yeah, looks good. So they smile more, obviously, when they're proud of their smile.
Yeah, the funny thing about Casey, he keeps coming back for his maintenance and cleanings and stuff like that. And every time he comes in, he tells me, I just came back from whatever. And that makes me jealous, because every time I see him every 3 months, he goes to different countries, he enjoys his life, and I don't think he would be able to do that looking like that.
So people with bad teeth, discolored teeth, aged teeth, you think or you say the patients say they feel judged. Is that right?
100%. I mean, look at any bad character in the movie. Look at all the villains. They all have bad teeth, bad smiles. So obviously you get judged. Like the teacher that I showed you that is teaching their kids and the kids are making fun of them. How do you live like that?
Yeah, and it's kind of an easy fix in a way.
Oh, I mean, if I had an opening in my schedule and you come in and you tell me I want to look better, I want to feel better, I want to feel younger, within 2 weeks, you're there.
So
you're
somebody
done.
watching this, really bad teeth and gums, a couple of weeks from now, they've got the new smile.
Absolutely. All you have to do is just pick up the phone. And I'm excited to show you this picture. This is Laura. What do you think Laura likes to do in her spare time?
What?
She lives on cruises. I just saw her the other day, and she went, I believe, through 8 cruises this year. And before she started doing that, she said, Dr. Marlen, I can't look like that and go out with my husband on the cruises. Can you do something? Can you please give me a more confident smile? And I mean, take a look at Laura.
Wow, very nice.
Who would enjoy that drink sitting in the lounge of a cruise ship? The old Laura or the new Laura?
Yeah, because she likes the way she looks.
She loves it. She enjoys it.
And that's like veneers?
It is actually veneers, correct. Randy, would you tell me that Laura in the after picture looks younger than the Laura before?
Yes, for sure.
Would you tell me that she looks healthier than before?
Yeah.
And that's exactly what the Smile Makeover does to people. It gives you confidence, it makes you look younger, it ages you gracefully.
So with these patients, they're obviously numbed up, but do you offer sedation?
We do have different types of sedation. Most of the people really only need some laughing gas and some local anesthetic to do this, and they're extremely comfortable. I mean, if someone does need an anesthesiologist, we do work with an anesthesiologist that comes to the office to make it more comfortable for some fearful patients. Randy, this is another patient, Phil, who was so fearful of dentists that his wife actually called to make an appointment for him.
His teeth look pretty good.
His teeth look decent, but again, he's another grinder and clencher. In fact, he also had sleep apnea, airway issues. So what we did, and because he was grinding and clenching his teeth, he had constantly sore muscles. He had some ear issues. Again, we call it TMJ dysfunction. But the beauty of what we did with the Smile Makeover is we were able to get rid of those headaches that he was having. We did make a nighttime appliance for him that helped him with the airway and in general made him
sleep better?
Healthier.
Okay.
Sleep better and healthy in general, and stop snoring. That was driving his wife crazy. And that's Phil now.
Oh, yeah.
Look at that gorgeous smile, and again, this
looks good.
The beauty of Phil is, while he was always afraid to come to a dentist, on the clock every 3 months, he loves to see our hygienist just to keep up that beautiful smile. Randy, I want to show you Amina. We started talking about the TMJ dysfunction just to say something, just to explain what the TMJ dysfunction is.
That's the joint right here?
That's the hinged joint that connects your lower jaw to your skull, and that's the joint that's responsible for eating, smiling, functioning. When it functions normally, people don't even know they have it, but when it's out of whack, it causes multiple of symptoms. It causes headaches, it causes clicking and popping, it causes ear aches, neck aches, causes airway like sleep apnea issues also. So Amina is a medical student, medical school student who was literally suffering. When she came in, she said, I mean, I am in school, I have a lot of studies to do, and I can't function normally.
Because it hurts?
Because it constantly hurts. She has headaches, muscle aches, constant tension.
So is this
in
right
her
up your
face.
alley? Like when you see this or do your diagnostics, you're going, boy, this is going to be
And
a good one.
that's exactly what we did. When I just saw Amina, I looked at her digital pictures, at her smile, and knew exactly that I'm the one who will be able to help her.
Okay.
And again, through some orthotic therapy that we do, first thing that we do before we do anything irreversible with people that are suffering with symptoms and pain in general, we want to make sure that they're feeling better before we put any veneer or any crown on their teeth. So Amina went through phase 1 therapy, orthotic therapy, that again, through special technology, we sort of realigned her jaw to a better 3-dimensional position that caused the muscles of her head and neck and the joint to function normally in a healthy state. All her symptoms disappeared. I mean, she was so grateful. She said that I can finally study and ace all my tests just because I'm feeling functioning better. And look at Amina after phase 2 when we were able to, again, restore her smile.
Very nice.
And give her that beautiful smile, pain-free smile.
Now, so I'm understanding this correctly, because if the teeth are coming together properly, it's less like pressure on this joint, so the symptoms go away.
That is absolutely correct.
Okay.
So when the teeth are aligned properly, when the jaw is aligned properly, when the teeth mesh together properly, it gives harmony to the muscles of the head and neck. It gives harmony to the joint, and the pain just goes away.
So when she comes in, she says, because you were saying she was having a tough time in medical school with these issues. No longer a problem.
Pain-free.
What does she say?
And not only pain-free, looking beautiful too.
Okay, very nice. Time for a couple more. I'm going to rush you a little bit because I know you still have a stack.
Siobhan, gummy smile. Doc, hate it. I mean, I said, Siobhan, you have a pretty good smile. She said, no, I hate it. I hate that gummy smile. I hate my front discolored tooth. What do we do? Siobhan after.
Wow, looks great.
Look how everything is aligned against her lower lip. She looks beautiful. She looks gorgeous. Kathy, she's actually my patient coordinator. Another TMJ sufferer. Constant tension in the face. She does have pretty decent teeth, pretty good teeth, but constant pressure was driving her crazy. Looking younger, in your opinion, all her symptoms went away. Tension in the face, clicking and popping, neck pain, gone. Here's another patient.
All right.
Embarrassed to smile, to say the least. He said that, again, he is a former cop, by the way. He wanted to feel better. Look at that.
Are the patients, because you've been on the program before, are the patients for cosmetic dentistry getting older and older, younger and younger, or a mixture of both?
We definitely get a mix, but I would say probably what unites them all is they're at the point of their life when they're ready to make that next step, to feel better, to feel healthier, to be wanted, etc.
We're out of time. So people watching this, they have really bad teeth and gums. They don't like their smile. It's aging, not responding to whitening. They've heard what you have to say. Maybe they have TMJ problems, headaches, whatever. But they're skeptical or afraid of the dentist. What do you say to them?
I invite them to pick up the phone and make a phone call and schedule an appointment for consultation. Again, this process of 60 to 90 minutes of listening to them, to getting them educated on what we see and what can be done to change their life is transformative in the fact that, again, you'll know exactly what you have and what can be done to feel younger, to feel healthier.
Okay, good for you. I want to thank you for coming on the program. Always a pleasure. And so they can call you. What about the website? Do you prefer they go to the website, make an appointment there, or just call you?
Either they can call or they can go to the website marlenelitedental.com and learn about everything that we do in the office.
All right, thanks for coming on the show.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.